Welcome to Quick Medical Review, where we simplify complex medical topics for doctors and medical students. In this episode, we are reviewing stable angina pectoris, a key topic in cardiology. Stable angina pectoris is a type of chest pain that occurs predictably with exertion and is relieved by rest or nitroglycerin. It's a classic manifestation of coronary artery disease. What's happening here is that the heart's oxygen demand exceeds the supply due to narrowed coronary arteries, leading to ischemia during physical activity or stress. The key point: it's predictable and doesn't cause permanent damage. The underlying pathophysiology of stable angina centers around atherosclerosis. Over time, plaque builds up in the coronary arteries, reducing blood flow. During physical exertion, the heart needs more oxygen, but those narrowed arteries can't keep up, leading to transient ischemia, and that's where the chest pain comes from. It's important to remember that unlike acute coronary syndromes, stable angina is not associated with plaque rupture. Clinically, patients with stable angina typically describe a pressure or squeezing pain, often retrosternal, that radiates to the left arm, neck, or jaw. It's important to note that the pain lasts a few minutes and is promptly relieved by rest or sublingual nitroglycerin. Other associated symptoms might include shortness of breath, fatigue, and sometimes diaphoresis. If the pain persists despite rest, it could indicate unstable angina or myocardial infarction requiring urgent intervention. Diagnosing stable angina involves several key tools. An ECG might show ST segment depression during an episode, but it's often normal at rest. Stress testing, either with exercise or pharmacologically, can provoke ischemia, helping to confirm the diagnosis. For definitive assessment of coronary artery disease, coronary angiography remains the gold standard. Cardiac biomarkers like troponins will typically be normal since there is no myocardial damage in stable angina. The management of stable angina focuses on relieving symptoms and preventing disease progression. Lifestyle changes are foundational. That means smoking cessation, regular exercise, and a heart-healthy diet. Medications include nitrates like sublingual nitroglycerin for acute relief, beta blockers to reduce heart rate and oxygen demand, calcium channel blockers if beta blockers are contraindicated, aspirin to reduce thrombosis risk, and statins to slow the progression of atherosclerosis. In patients with severe disease, revascularization options like PCI or coronary artery bypass graft may be indicated. While stable angina is chronic, it's generally manageable with treatment. However, if left untreated or poorly controlled, it can progress to more serious conditions like unstable angina or myocardial infarction. With appropriate care, patients can maintain a good quality of life. To summarize, stable angina is a predictable form of chest pain that results from myocardial ischemia due to coronary artery disease. Diagnosis is typically clinical, supported by stress testing and, in some cases, angiography. Management involves lifestyle modifications, pharmacotherapy, and possibly revascularization. The prognosis is generally good if managed properly. Thanks for tuning in to this episode of Quick Medical Review. I hope this recap on stable angina has been helpful. Be sure to subscribe and join us next time for another concise medical review.